about manual muscle testing. A lot of you out there in video land are familiar with Florence and Kendall's manual muscle testing, where you would check the strength of say the rotator cuff, the neck muscles, any muscle. But I use manual muscle testing a little bit differently. I certainly do these tests, but you can also use it to help differentiate which tissue might be impaired. Sometimes when we do an examination, you start going through these tests and it's not as clear as you would like. And so for instance, we're gonna take you step by step in how I do this. So say you get a patient come in, they're doing their evaluation and you're not really sure what's going on. You rotate their neck to the right, like, oh yeah, I got pain this way. And then they have pain when they extend, and you're like, oh man, is it levator scapula? Is it the facet joint? What is it, right? So I can do two tests. Obviously I can do my active and passive range of motion, but sometimes it's not always so clear with patients. So this is just more evidence to add on to the layer. So what I can do is position Pat this way, and then I can say, Pat, hold there, don't let me move you, right? And so if he still has pain with this, I'm not really sure, is it the joint closing down causing his pain, or is it the muscles? Because he's in this closed back position of the cervical spine. So now what I can do is still kind of do the same thing, but now position him with his facet joint open. And if it's a true muscular dysfunction, and I now still do the same MMT, that should be painful. So in this case, if it was painful, I would be pretty certain that it is levator scapula or some sort of muscular neck joint related pathology.